I've got some very fancy slides here. We've got some black text on a white background. Okay, so I'm going to pretend there's more people watching because it's just weird talking to the two of you. I'm going to assume there's going to be 50 people watching the replay. So here we go. This presentation is about BACME. BACME is the British Association of Clinicians in MECFS. What is BACME? This slide is a very brief overview. BACME was founded in 2009. It describes itself as a multidisciplinary organization providing information, resources, education, and networking opportunities to UK professionals to deliver high-quality care to people living with MECFS. BACME's members are clinicians, researchers, psychologists, doctors, nurses, occupational therapists, physical therapists, and clinical managers. The reason BACME is important is because most or all of the clinicians working at MECFS clinics all over the country get their information, their training, their education, their professional development from BACME. Therefore, BACME has a tremendous influence over how the MECFS clinics are run. BACME was a stakeholder in the development of both the 2007 and the 2021 NICE guidelines, which is odd because those two guidelines are very different, but BACME was involved in both. BACME is a charity and they receive lottery funding. Okay, so I just thought it was interesting to look at who's not in BACME. A lot of the UK's most respected, highly regarded clinicians and organizations in ME are not in BACME. Dr. Nigel Spate, I have trouble pronouncing his name, but it's Spate. Dr. William Ware, Dr. Claire Taylor, the 25% group, Doctors for ME and Physios for ME. These are all people or groups that are highly respected by the ME community, and none of them are involved in BACME. That's interesting. So BACME has
I can still only see the title slide. I don't know if the other slide.
Yeah, I'd assumed you hadn't moved on. I assumed you were just talking over.
I've been motoring on through several slides.
Oh, right.
Stop and start again and see if that fixes it. Share screen. I'm going to try to do it a bit differently, and I'm going to try sharing just my desktop instead of sharing a particular, and you can all just let me know if that works. So what are you seeing?
Yeah, we're seeing it full screen now.
Yep.
That's me,
okay,
pre-2020.
Brilliant, brilliant. Thank you. Thank you for stopping me. Okay, so just to briefly look at what BACME was like pre-2020. I think we all know this, so this is very boring, but just for completeness. The chair of BACME back then was Esther Crawley, who is famous for CBT, GET, and the lightning process, all of which were pushed on children and young people. BACME pushed very strongly that CBT and graded exercise therapy were curative treatments for ME. They promoted the biopsychosocial model of ME, which claimed that ME is driven by behavior, conditions, and false beliefs. And this is a prejudice that continues to this day, especially among healthcare professionals. In the pre-2020 days, people who attended the local MECFS clinics were treated very, very harshly and cruelly, particularly the young people. Graded exercise therapy caused long-lasting, devastating harm, and some people who had been mild or moderate became severe or very severe. BACME has never acknowledged this harm, and they have never apologized for it. Can you see a new slide?
Yep.
The slide should have changed. Brilliant, brilliant.
Yep.
Okay, so in 2020, they had a big change. They published a position paper where they said their new beliefs. So the next few slides will be about what their new beliefs are. So BACME no longer believes in deconditioning, or at least they don't believe deconditioning is the cause of ME. Instead, they believe dysregulation is the cause of ME. Dysregulation is a vague medical term. It means something in the body isn't working properly. Even though BACME no longer believes that deconditioning causes ME, they haven't fully renounced or given up the biopsychosocial model. As far as I can tell, they have not given up the idea that patients' thoughts and behaviors contribute to ME. Next slide. So continuing on with their big change, graded exercise therapy is out, but graded activity is in. BACME no longer recommends GET, but they recommend graded activity. And what's the difference? Well, they claim the new approach is flexible. BACME says that it supports grading activity strategies when delivered by an ME/CFS specialist clinician to make increases and improvements in physical, cognitive, and emotional function from an identified stable baseline. So the ME Association, Action for ME, and Physios for ME have all put out statements criticizing this. They also talked about having a focus on rehabilitation. They think that people with ME need rehabilitation. This is wrong because rehabilitation is for people who are going to get better. If someone's been in a car accident, they can be rehabilitated, they can get better. People with ME are still sick, so rehab is not appropriate for us. Next slide. BACME talks about clinically effective treatments, and they don't really explain what that is or give evidence to support it. They're basically saying that whatever treatments BACME gives are the clinically effective treatments. I won't read out the statements, but Action for ME and Physios for ME have both pointed out that this is nonsense, and that if you want to say your treatments are effective, you should give evidence for that, which BACME does not. Next slide. So BACME produces resources, management guides, and things for clinicians to read. And it does seem that many of the local ME/CFS clinics, the way they do things and the information they give to patients is based on BACME's resources. So BACME's resources are very important. And the rest of this presentation is about BACME's resources. The resources are not peer reviewed. They don't undergo any external review. BACME just writes whatever they want, and no one checks their work. So I haven't fully read everything they've written. That would be very difficult. There's a lot, but I have sort of scanned through, I've skimmed through, and I've searched for certain keywords. The resources are not uniformly terrible. I'm going to acknowledge there are some parts that are good and are reasonable and are even possibly helpful, that there are many other parts that are outdated and harmful. So next slide. BACME believes that post-exertional malaise is fatigue. I'll read out what they say. BACME says, one of the hallmark symptoms of ME/CFS is a pattern of fatigue called post-exertional malaise, PEM, They do acknowledge that it is different to other types of fatigue, particularly regarding the management of daily activities, along with approaches to physical activity, including exercise. But they're still saying that post-exertional malaise is fatigue, which is kind of like saying that the earth is flat and the moon is made of blue cheese. It's just not true, and it doesn't make sense. It's scientifically illiterate. It's kind of hard to even explain what's wrong with it, because it's like explaining that 2 + 2 isn't 5. Like, how do you explain that? It's just so wrong. I don't know how to deal with it. Anyway, next slide. BACME does not acknowledge the worst consequences of PEM. They do acknowledge that PEM can last hours, days, or weeks. But we all know that PEM can last longer than that. So they are acknowledging a little bit that PEM can be harmful, but they're not acknowledging the full range of harm, which is possible. BACME and pacing. BACME is really strange on pacing. Some of their literature and materials behave as though pacing doesn't exist. There is one document that does mention pacing and even kind of gets it right. But this document, which mentions pacing, does have a lot of false assumptions. BACME is assuming that the problem people with ME have is that we tend to do too little activity. We all know that's wrong. Everyone is trying to do too much activity. The problem we have is trying to get it down to a safe level. BACME assumes that people with ME want to lie in bed all day and need encouragement to get out of bed. And BACME believes that people with ME should gradually increase their activity. And even when they do mention pacing, I didn't find their information very useful. I've looked at the ME Association. Their guides to pacing are actually useful. So there's good information on pacing out there. It's just not in BACME. Next slide, BACME and sleep. BACME puts a lot of emphasis on sleep. They emphasize sleep hygiene. They emphasize relaxation techniques such as breathing exercise, which may calm the nervous system and lead to better sleep. This stuff is good and it's useful, but BACME really seems to overestimate it. BACME, it kind of seems like they think that this stuff is a treatment for ME/CFS, which can improve ME symptoms. And I think we all know that having better sleep will help a lot, but it's not a cure or even a treatment for ME. Next slide. Okay. This one gets a bit complicated. Dysregulation is a sneaky bait and switch. BACME says that dysregulation is a cause of ME. Okay, but what is dysregulation? At one point, BACME says that dysregulation means problems with the immune system, the autonomic nervous system, the hypothalamic pituitary axis, and cellular metabolism. That's fair enough, it's true. But later in the same document, BACME changes the meaning of dysregulation. Now they say that dysregulation means deconditioning and changes to the autonomic nervous system, which are caused by lying in bed and not getting enough activity. BACME is very, very strongly implying that ME is caused by dysregulation, which is caused by deconditioning and changes to the autonomic nervous system, which are caused by lying in bed too much. So they're saying that we have ME because we lie in bed too much. They're not saying it outright, they're dancing around it, but they are saying this. And to point out the obvious, it's nonsense. It's just not true. It would be nice if it was true, because then it would be so easy to cure our ME. Wouldn't that be great? Okay, next slide. Okay, BACME implies that patients want to lie in bed all day. Their document has paragraphs and paragraphs and paragraphs and paragraphs about how it's bad for patients with ME to lie in bed all day when they don't need to. Now, it's not even wrong. Like if someone with ME who could get out of bed chose to lie in bed all day, that would be bad for them and it would be good for them to get out of bed. But when you read this, you really get the idea that there's a problem with people with ME lying in bed, even though they could get out of bed. The reality, as we all know, is that the only people who lie in bed all day are the people who are forced to because they are that severely ill. So clinicians are reading this document and they're really going to get the idea that people with ME are very, very lazy and don't want to get out of bed. And it's simply not true. Next slide. Okay, BACME and nutrition. I know this is going to be revised or reviewed at some point, but just briefly, BACME does recognize that malnutrition can cause problems. On the other hand, they're not actually recognize the risk of deteriorating health and death. So they're not fully recognizing the danger of malnutrition. BACME says that people with ME may imagine that they have food intolerances. There's so much I could say, but I'll just say there is no evidence for that and leave it at that. BACME says that self-neglect is a factor in malnutrition. Now, it is true that some people are unable to care for themselves, but self-neglect it's not that. No one is self-neglecting. There are people who are unable to care for themselves because they're too sick, but no one is self-neglecting. That is just blaming the patient. Okay, so a positive thing is that BACME does recognize that some patients need tube feeding because they're not able to eat. But a big negative, BACME says that disordered eating is common in people with ME. They say that people with ME commonly have eating disorders. Now, to state the obvious, that's just not true. If it was true, we would know it. Go to PubMed, look it up in PubMed. We have science, we have scientific literature. It's very, very easy to find out that this is not true. There is no evidence for this. It is nonsense and it's made up. Next slide. Okay, instilling hope. BACME puts a big emphasis on instilling hope, telling people that they can get better. I worry that this is giving people false hope, basically. Next slide. The data collection at the ME/CFS clinics is very, very poor. So basically, BACME may be saying that they're interventions work, but they don't have evidence to back it up. What evidence they do have is of such poor quality, scientifically speaking, that it's just not worth anything. Very briefly, what I think is happening at the ME/CFS clinics, I think that many of these clinicians still think that ME/CFS is behavioral. They believe that if they can get the patients to do the right things and think the right thoughts and have the right activity plans and grade their activities, they think that this will make people get better. I think people who attend these clinics, they're new to ME. They recently got ill, or else they've recently found out that what they have is ME, and they're desperate to get better. Clinicians are telling them that they can get better, and of course these patients are very grateful and happy to hear that. Of course they are. There is a therapy effect. Whenever anyone gets any kind of therapy whatsoever, they feel a bit better. It's like a placebo. People only attend the clinics for 8 sessions or so. I'm sure that varies from clinic to clinic, but that's not long enough to realize that BACME's approach doesn't necessarily work. So I think BACME isn't necessarily getting the long-term feedback that their approach isn't necessarily helping. I think the clinicians are good people who are doing the best they can and believe that they're helping. They don't have data to tell them whether their interventions work or not. An additional wrinkle, finally, is doctors are still very clueless about ME/CFS. A lot of people with ME/CFS aren't diagnosed, and a lot of people who don't have ME/CFS are given the wrong diagnosis. So a lot of the people in these clinics don't even have ME/CFS. That's an additional wrinkle. Okay, this is almost done. I'm sorry it's so long. BACME clinicians are getting a few things right. I think these days they mostly validate the patient's suffering. The new flexible graded activity is not as bad as the old graded exercise therapy was. So they're not as bad as they used to be. Oh, and we're done. Yay. These are the references and links.